Hello, this is Dr. Tony Nalda talking to you regarding your blocking package or your home care blocking system. Today we'll be talking about pelvic rotation. Now, pelvic rotation is a very common subluxation pattern that we unfortunately see with patients, so we have a blocking system to help reduce that subluxation pattern. The way you do this is you're going to use your appropriate cervical roll. This one I'm showing the medium roll, but of course you're going to use the one that's set up for you, whether it be the firm or the small, whichever one you're using. Then you're going to use both wedges, and both wedges, you're going to be positioned off-center like this, kind of with the thin parts pointing toward the center of your body and the thick parts pointing toward the outside of your body, kind of either in this position or kind of like in this position, depending upon how your rotation is. So we go ahead and set up here how we set that up. So this is go ahead and lay down. We're going to have her lay down on her cervical roll, and then the idea is that we're going to have these blocks put in, and we're going to go ahead and lift this hip up first, and it's going to go under here and that, and then this one's going to come over here. Okay, and they're kind of like in like this to help reduce the pelvic rotation. What it's doing is going to lift this hip up, and it's leaving space for this hip to go down. So it's creating this torquing of the pelvis. And the idea is that depending on which side you have the blocks on, will depend on which ones you're de-rotating, which one you're rotating forward, which one you're rotating backwards. So let me go ahead and lift your hips out. So the blocks are kind of set up like that on her. So this is just under her pelvis, and this one's more under kind of her upper thigh going in like that. If I was going to set up the opposite position, it would be like this. Okay, so let me go ahead and show you. Come up here. This one goes under there. This one comes over here. And that would be the opposite pelvic rotation. Now again, this is the position that you wouldn't sleep on. It's a position that you do for 20 to 30 minutes, once or twice per day, depending on how your doctor prescribes it. Some people go longer, some people go a little shorter. Just make sure that you follow your doctor's prescription. Now, sometimes you can also use this with your lumbar roll. You can possibly have your smaller roll kind of positioned right here, but in most cases, this is the way it's done, just like this.